that our immunization program fully includes you too. We have a plan in place and we're rolling the vaccines out to every corner of the province. But the majority of vaccines we've received so far aren't easy to handle. Not only do they need super low temperatures, but at every step of the trip at immunization clinics, but there's not been a lot of those doses as well, and that's the biggest problem. There is, however, reason to have hope. We've been promised hundreds of thousands of doses over the next few months. And that's why we've made the bold promise to offer the vaccine to everyone and every adult in Alberta by the end of this June. In the meantime, we are so grateful that pharmacists here in Edmonton and across Alberta are doing so much. We know the interest and the demand is there in cities and towns all over the province, but the speed of our vaccination rollout depends wholly on the amount of vaccines that we receive from the Government of Canada. We unfortunately continue to be let down on that front. Just this week, we were informed that a malfunction in a cargo aircraft that was headed to Alberta meant that we saw delayed shipments of Moderna vaccine doses, which meant delayed inoculation at 43 Alberta pharmacies. What's worse, we've now learned that this week's shipment of Moderna vaccines will actually be split over 2 separate weeks, effectively cutting shipments in half. This is entirely the responsibility of the federal government, and they have not given us an explanation. Worst of all, it may force some pharmacies to reschedule thousands of bookings to next week. I'm sorry for that inconvenience, but once again, it's the result of unexpected interruption in supply from the Government of Canada. We know that the more vaccines we have, the faster we can get them to pharmacies, into clinics, and into the arms of Albertans to protect them. But we need the federal government to keep its word and actually deliver the doses that they have confirmed. If, and this is a pretty big if, but if we get the vaccine supplies we've been promised, we'll eventually be able to expand the immunization program across the province to include over 1,300 pharmacies like this one. And that's just pharmacies. Community physicians will start offering vaccines next month. And I want to thank the Alberta Medical Association for their partnership in that, in addition to the big Alberta Health Services immunization clinics. Alberta is ready. Our healthcare partners are ready, and we're working on offering even more ways to get you a vaccine. It has been a very long road this past year, but the end of the pandemic is clearly within sight. We've been told to expect millions of doses of COVID vaccines over the next few months, and Alberta's government will continue to do everything possible to advocate to get those doses as quick as possible to ensure those promises are kept. We'll continue challenging the federal government to keep ramping up these shipments and bringing them in as soon as they are approved by Health Canada. So with every pharmacy delivering this vaccine, we get another step closer. So thank you for that. And now I would invite Minister Shandro to say a few words, and then I think we'll hear from folks from the pharmacies.
Well, thank you very much, Premier. I'm very happy to be here this afternoon to make this announcement about the doubling of the pharmacies in Alberta who will be providing COVID vaccines to Albertans. And I want to start off by thanking all of the pharmacists, all of the nurses, all of the physicians, and everyone else who are helping administer the vaccinations and getting them into the arms of Albertans as quickly as we receive them. Your hard work, your dedication is deeply appreciated. You're turning the tide on the pandemic, and you're allowing us to carefully ease restrictions so that Albertans can get back to doing the things that are important to them. So I'm pleased to join Premier to, as I said, to announce that we're further expanding the number of pharmacies offering vaccinations. And thanks also to Jeff Leger and Margaret Wing for joining us today. When we heard that the first vaccine was approved and that it was on its way, we made a promise. We promised Albertans that we would get the doses out to Albertans as soon as we got them in. And we're delivering on that promise, thanks to the hard work of our health professionals. And pharmacies are a key part of that work. As Premier said, local pharmacies are supporting the health of Albertans in the communities day in and day out. Pharmacists are highly trained professionals. It's well within their scope of practice to administer these vaccines. And so thanks to our annual influenza campaigns, they also have the reporting systems in place and other infrastructure that is needed for them to be a part of COVID vaccine rollout. And this ensures that the doses aren't wasted. It ensures that every patient is immunized safely and efficiently. And we started with 102 pharmacies in Edmonton, Red Deer, and Calgary, and they've already given more than 35,000 doses as of yesterday. And they're a big part of why we broke 400,000 vaccinations yesterday. It's a big number, but it's just the start. It's going to grow a lot faster over the coming weeks, in large part due to the support of our pharmacies. And the people who work in community pharmacies work hard to earn the trust of their patients. They answer questions about vaccines, as well as their patients' regular healthcare needs. And so we've been working closely with the Alberta Pharmacists Association, commonly referred to as RXA, to bring more pharmacies on board as the supply of vaccines continues to allow us to. And more than 1,300 pharmacies have told us that they're ready, that they're able to help deliver the vaccine. So we've more than doubled the number of pharmacies offering vaccines to 259. And there's a lot more to come. We're expecting to double the number of pharmacies offering vaccinations again within the next month to a total of 500. And as with our annual influenza campaign, community pharmacies will be the largest provider of the vaccine to Albertans. And this includes pharmacies across the province. It includes pharmacies in communities like Medicine Hat, Ponoka, Grand Prairie, as well as Fort McMurray. And every participating pharmacy must follow strict safety protocols to protect the health of everyone involved. And we're expanding quickly, but note that you still need to book an appointment. That's to manage the supply and to manage the numbers of folks who are on site at any one time to ensure safety. Now, to find out if your local pharmacy is offering the vaccine, visit the Alberta Blue Cross website, click on the COVID-19 banner at the top of the page, and we encourage you to check back often. The list will be updated frequently as more and more pharmacies throughout the province are enrolled in the program. And at this time, the supply of vaccine that Alberta is receiving from the federal government is not enough to meet demand. As Premier mentioned, the unexpected change in the number of Moderna doses arriving next week means that smaller shipments will be going out to our pharmacies, and some may not receive any doses at all. And this may mean that appointments that were booked based on confirmed allocations from the federal government must now be rescheduled. And this is, as Premier said, unacceptable. It impacts our ability to immunize Albertans. But it's a temporary setback, and it won't slow down our expansion overall. Every new pharmacy offering vaccines means that thousands of more Albertans get their doses quicker and that they get them closer to home. When we said that every Albertan who wants a vaccine will get one by the end of June, it was based in large part on the role of our pharmacies. We know that the demand is there. We know that the vaccines are the path to opening up life again. And as long as the federal government meets the delivery commitments that they have provided us, we're looking at life at the other side of the pandemic this summer. And so thank you. I'll now invite Jeff Leger, who's the president of Shoppers Drug Mart, to say a few words.
Thank you, Premier Kenney and Minister Shandro, for visiting our store today and for the confidence you continue to have in Alberta's pharmacists. My name is Jeff Legier. I'm the president of Shoppers Drug Mart, and I'm a pharmacist myself. I want to take a quick moment to also thank our store teams who have continued on the front lines throughout the COVID-19 pandemic. In particular, I want to thank Shivali for hosting us at the store today, for taking time out of what I know is a very busy day. In our organization, we've been preparing to distribute and administer COVID vaccines since last November. In that time, we've had extensive conversations with all governments to offer advice on vaccine rollouts. A few weeks ago, we began vaccinating Albertans aged 75 or over with the Pfizer vaccine at select stores. In fact, one of our stores provided one of the first vaccines in a community pharmacy back on March 4th. In looking nationally at rollout plans, we think Alberta has gotten it right. They have quickly lowered the age cohorts eligible to be vaccinated, and they put their trust in community pharmacists to accelerate the pace of vaccinations. Alberta was the first province to deploy community pharmacy and vaccine rollout plans and to tap pharmacists to inject with Pfizer or other COVID vaccines. Pharmacists are among the most trusted healthcare professionals. We provide convenient community-level health services and advice in nearly every city and town throughout the province. Alberta has shown tremendous leadership making vaccines accessible in community pharmacies, which allows it to be close to residents. Our hope is that someday soon, every one of our more than 1,800 pharmacies, among the more than 10,000 community pharmacies across the country, will be vaccinating patients. Together, we believe these pharmacies could vaccinate up to 3 million Canadians each week. As I wrap up, I want to say thank you again to Premier Kenney and Minister Shandro for your work in bringing this initiative forward and enabling pharmacists to help our community stop the spread of COVID-19. Thank you. I'll now invite Margaret Wing, who's the CEO of RXA, to join.
Thank you, Jeff. I'm very pleased to be here on behalf of the Alberta Pharmacists Association today. I couldn't be more excited to hear that the COVID vaccine program is expanding to pharmacies across this province. I would also like to thank Premier Kenney and Minister Shandro for their leadership and commitment in mobilizing Alberta's workforce of pharmacist vaccinators. Pharmacists really are very skilled healthcare professionals, and they have safely and efficiently vaccinated many Albertans, as Premier Kenney noted, in our most recent influenza season of about 1.5 million Albertans. I'd like to thank Alberta pharmacists and their teams. I know how challenging it has been in recent weeks, where they have received tens of thousands of phone calls and booking appointments for Albertans so eager to get their COVID vaccination. So I'd like to thank them for their commitment to this program and also for their understanding around the challenges and uncertainty related to the COVID vaccine supply. I can assure you that I'm hearing from many, many Albertans who are so incredibly happy that their pharmacist has been able to give them their COVID vaccination. So thank you, pharmacists and your teams out there. And I can also assure you that at the association, we're going to keep working with Minister Shandros and his team at Alberta Health to get this program deployed to as many pharmacies that are interested in offering COVID vaccine to their patients. So what can you expect in the weeks to come? Well, as vaccine supply can be ensured to come into the province, and as we can get vaccine out to the pharmacists that are able to administer it, they have the potential to vaccinate at least 250,000 Albertans on a weekly basis. So there's good things coming. Thank you.
Thank you, Margaret. We'll now go to the phones for questions. We'll do one question, one follow-up. Operator, can you please put through our first caller?
Thank you. The first caller is Dean Bennett, Canadian Press.
Thanks very much. For the Premier or the Health Minister, Monday is the day when you're going to start reviewing whether or not to reopen sectors of the economy more. Given the numbers we're seeing, the variant numbers, can we expect anything to change on Monday or anytime next week?
Sorry, Dean, 1 second. Got to do my ablutions here. Actually, before I answer your question, Dean, I understand there was a technical problem on our live feed off the top, so I just wanted very briefly to restate the key message of today's announcement. We're here at Shoppers Drug Mart at Rabbit Hill Mall in Edmonton, and we're here to announce that we've doubled the number of pharmacies delivering the COVID-19 vaccines to Albertans. We hope to be able to administer over 60,000 doses through our community pharmacy partners this week alone. And as soon as we get adequate supply out of the federal government, we hope to be able to ramp that up to over 1,100 pharmacies, over 1,300 pharmacies, across the province. And today was partly just to underscore the great partnership, and we are well ahead of any other province in helping to make it more convenient for Albertans to be vaccinated against COVID-19 at their neighborhood pharmacy. And just very quickly, we encourage people to go to their pharmacies. It's the most convenient way if they're nearby. If they're not nearby a pharmacy delivering the vaccine, we encourage them to go to the AHS website and figure out the closest AHS facility. So on your question, Dean, the answer is that we will be receiving advice from the Chief Medical Officer and reviewing that over the next few days. The Cabinet COVID Committee will meet on Monday to look at the most recent data. As you know, in the Path Forward plan that we published in February, if the provinces has under 300 people hospitalized with COVID-19, then that's the key metric to move towards step 3 in the path forward. We've outlined a number of the kind of activities that would be subject to relaxation of public health measures and restrictions at step 3. We have been at under 300 hospitalizations now for, I think, about a month. Maybe it's more like 5 weeks. And so it's been pretty stable. It's clear that things have plateaued. We have stopped seeing the decline in new daily cases, total active cases, and hospitalizations, but they have been stable. Of course, there have been little blips up and little blips down, but basically the situation has been relatively stable. As you know, Dean, we are concerned about some growth in variants of concern. Thankfully, so far, that has not become the dominant strain. It's at about 10% of active cases here, as opposed to like 50% of new cases, as I understand, in the province of Ontario. So, Dean, we I guess we're going to have to take a look at all that data, but our key benchmark is that we're at about 250 to 260 folks in hospital with COVID, only about 40 in ICU, meaning we have enormous flex capacity in the health system, and we are every day vaccinating more and more of the vulnerable. One of the most important things to watch has been the steep decline in the COVID-related death rate. We've been pretty consistently had daily deaths reported in the single digits. Every one of them, of course, is a tragedy for a family. Our hearts go out to those affected, but this is, I think, is largely because we've successfully administered both a double dose of vaccines to the residents of long-term care and designated supported living centers, where 2/3 of our fatalities had occurred. So those are some of the factors we'll be looking at, Dean, but I can't make an announcement yet because we haven't made a decision.
Dean, do you have a follow-up?
No, thanks. I'll pass my time to someone else.
Thanks, because I took enough time for 2 questions. I know, I'm sorry. I'll try to be briefer.
Operator, can you please put through our next caller?
Thank you. Chris Varco, Calgary Herald.
Hi, I've got a couple questions for the Premier. Premier, there's news today or I guess yesterday, about some litigation in the United States by the Attorney Generals of Texas and Montana over the Keystone XL pipeline. I guess, what is your reaction to the news that the AGs down in these states are filing a multi-state complaint against the Biden administration demanding the reinstatement of Keystone XL? And just separately, has Alberta determined what its best option is yet to recoup its investment in the project?
Thanks very much. Yes, we'd like to thank the 21 United States who are joining together to challenge the administration's rash decision to veto an approved pipeline that's already crossing the border. We have been in ongoing discussions with a number of those states. Just yesterday, I was on the phone with the governor of Montana. Last week, I spoke to his attorney general, who I believe led this effort. We've been in touch with officials in Texas and many other U.S. states. And we've been encouraging their efforts. This is their own initiative. And I appreciate knowing that you've got nearly half of the American state governments who are standing up for their citizens, for jobs, for energy security, and also for the Canada-U.S. relationship. This is very encouraging. I can't comment on the prospects of success in their legal effort, but I think it's great to see that this underscore that the vast majority of Americans support this project, and certainly all of the state governments along the pipeline route do as well. And we'll continue to cooperate with those and other state governments. We've also been in close touch with key members of the United States Congress, including, for example, Democrat Senate Energy Committee Chair Joe Manchin, who is a strong supporter of the project and who helped to get a rider attached to the budget bill 3 weeks ago, calling on the president to rescind his veto. On the issue of, sorry, what was the second one?
Whether Alberta has determined what its best options are to recoup its investment.
Thanks. So we've not made a final determination. We are in ongoing discussions with TC Energy about that. We had retained legal expert advice in the United States on our options 2 or 3 months ago, and they continue to refine their legal analysis about the best way forward. But as you know, and as I've said in the past, we do believe that Alberta has a strong case to make under the investor protection provisions of Section 11 in the North American Free Trade Agreement, which were grandfathered and brought forward under the new Canada-US-Mexico Agreement. And basically, to put it in layman's terms, what it says is that if a government approves something and an investment is made on that basis, government cannot then go back retroactively and change the rules. And if it does, then it owes compensation to the investor. That's a pretty basic principle of international trade law, and it's one that I think we have a very high prospect of success with. But we've got 6 months to file under Section 11, and so we are doing our legal due diligence.
Operator, can you please put through our next caller?
Jesse Weisner, Global TV.
Oh, hi. Thanks for taking my question. Related to the first question, indoor gatherings are set to be possibly eased as part of Step 3 on Monday. Is that looking likely given the situation we're in now? What do you expect for Easter gatherings? And what do you have to say to Albertans who see mass indoor gatherings continue against the rules in places like Grace Life Church? And that's directed towards the Premier and possibly Minister Shandro, if he has anything to add.
Sure. A lot of questions there. Look, we haven't made a final decision about Step 3 in our path forward, but the key metric there is having fewer than 300 patients in hospital with COVID-19, and we met that metric several weeks ago, and the numbers have been quite stable. We have to all, as Albertans, continue to be vigilant and careful. With respect, one of the things we have to be mindful of is the willingness of people to comply with what we're asking of them in these extraordinary measures. These things really, they are an interruption in people's normal lives that is, and in some cases, an abridgment of people's rights. And so we've always taken the view that those measures should be a last and limited resort, not a first and maximum resort. In terms of indoor social gatherings, that's be one of the things we consider as a COVID cabinet committee next week. I would say, regardless of what the rules are, as we come up to Easter, which is a traditional time of family gathering, and not just Easter, but other communities, for example, Vaisakhi, and there's a number of religious festivals which typically bring families together in larger numbers. And we would just ask people, please remember what happened in the fall. It's very clear that the fall spike started around Thanksgiving dining room tables in October, and then was accelerated by Halloween social gatherings. That those indoor social gatherings are the biggest cause of COVID transmission. So regardless of what the rules are, we just ask people, this is going to be a quiet Easter and other spring festivals. Please, to the greatest extent possible, keep to the members of your own household and keep each other safe. In terms of that particular church, once again, we have to keep a very clear line between those of us who are responsible for developing the policy and then the law enforcement agencies. They have a separate legal responsibility. We do not, in this country, have elected representatives micromanaging the operational decisions of the police or health or bylaw officers. We have to trust that they will make the right decisions in each circumstance.
Jesse, do you have a follow-up?
I think she asked already 3 questions, so
Sure,
we're giving you guys the follow-up opportunity, but you're all bundling them all in anyway, so.
Okay, we can move on to our...
Okay, go ahead.
Go ahead, Jesse.
Do I have a follow-up?
You got
Sorry. Okay. Some Albertans in Phase 2A were able to book their appointments before bookings officially opened up on Monday, and now Phase 2B will operate on the same honor system. How do you ensure perceived queue jumping doesn't happen again? What systems are in place to ensure it doesn't happen?
Thanks, Jesse. And we, like other provinces, are operating on the honor system, and we've seen Albertans falling through on that with the with Phase 2A. And we have all the faith in the world that Albertans know that they want the most vulnerable to get the vaccine first, and for them to get the vaccine when it's our turn. And so I have faith in Albertans that they will continue to do that. They'll continue to be trusted to follow through with the honor system. Thank you.
We have time for one more question. Operator, can you please put through our last caller?
Thank you. James Keller, Globe and Mail.
Hi there. Just going back to this pastor up in Edmonton, we hear from his lawyers that one charge has been dropped, another has been reduced, essentially a $100 fine. What message do you think that sends about how seriously the province is taking its COVID-19 restrictions? We've had other cases too, at restaurants that were charged and saw those charges dropped as some of the restrictions were changed. So what is the message?
Well, I think as Premier said, we have to leave the decisions about prosecution up to and not having it being micromanaged and influenced by politicians. We have to leave that to independent third parties, whether it's our police, our prosecutors, our public health inspectors. The public health inspectors, by the way, have, although they did want to start through education as a first step before they needed to enforce. But they have closed many establishments that were flagrantly not following the public health measures, that were ignoring the attempts of the public health officials to be able to provide them with better information, encourage them to follow the public health measures, and then they were closed if that wasn't the case. And then there were fines in some circumstances. It's best for us to leave those decisions up to independent third parties to decide on how it's prosecuted then. Premier, anything else? Okay.
James, did you have a quick follow-up?
A quick follow-up. Definitely, yeah. And again, the pastor's lawyer essentially said that if he's released, fully intends on holding another service this Sunday, as the church has been doing all this time. When you talk about some cases where the rules have been flagrantly ignored, again, what's your message to that church about their plans to continue holding these large services without masks and all that? in apparent defiance of these orders?
Well, I'll say this. I think we've seen Albertans. The reason that we've had our cases come down since the measures that came into place December 8th is because Albertans have followed the public health measures, and that includes our faith communities who have gone out of their way to work with Dr. Hinshaw and the Ministry of Health and AHS because they want to take care of their congregations. And now we have seen some Albertans, and whether it's this one pastor or others, sometimes flagrantly disregarding the public health measures. It is a rare circumstance, and it is unfortunate. It's frustrating for the rest of us who are following along with public health measures. We're doing our part. We want to see others do the same. So I guess that'd be my message to anybody who is not following the public health measures is that we have to continue to do this to take care of not just ourselves, but take care of the most vulnerable around us, to stop community spread, to allow the hospitals to continue to have the capacity to do the surgeries that are needed, the treatments that are needed, and everybody get the critical care that they need throughout the rest of the response to the pandemic. Thanks, James.
Thanks, everyone. That's all we have time for today. Have a good afternoon.